My name is Ben. I'm the medical advisor for Regional Resources Berhad. Blood test procedures can be divided into three. Yeah, one is diagnostic, which is does not involve any sort of like scanning. Yeah, technically is you go for ENT inspection, so you don't scan your throat or whatever. Yeah, you just diagnose. Diagnose means also you are doing a procedure whereby doesn't really go into the invasive or less invasive procedures. So it is non-invasive. Now the second part of health screening, which is what we call imaging. Imaging can be scanning, which is famously you do ultrasound, you do mammogram, you do X-ray, you do many tests that related to imaging, what we call scanning. Imaging being classified as less invasive or sometimes invasive, because when it's invasive or less invasive, it has got what we call radiation, which is a harm to your body. Now there's another one, what we call is actually laboratory, which is pathology. Means that the sample of blood gone into lab. Lab is considered as invasive because we need to draw the blood from patient. So meaning that is already invasive. So where the blood is sent to the lab. So health screening, a proper health screening or comprehensive health screening consists of diagnostic, consists of imaging, and consists of lab. So these three, you put it together, then it's become the comprehensive medical screening, or also people call as comprehensive medical profiling. Comprehensive blood profiling or comprehensive medical checkup usually consists of more than 100 test results, or what we call 100 parameters, right? Typically, if you look at the parameters, very famously, it covers the hematology. Hematology is basically basically covering on the blood, which is from the blood, you see, for example, you see hemoglobin, you see sort of like cholesterol, everything. But generally, a comprehensive medical profiling covers about 100 test results. With easily, in terms of procedures, it will consist of 25 to 28 or 30 procedures. Depend on the infrastructure that health screening or the medical facilities has got to provide you the screening. Every single health screening will be consulted by either MO, medical officers, or sometimes to the point that you have GP to come in. If you are doing a comprehensive blood test, which all this, you need to have probably someone more qualified to come in to interpret the results, because that report need to sign off by GPs. But predominantly, most of the screening centers in Malaysia getting the medical officer, what we call MOs, to do the consultation. And during the consultation, a patient can actually get to know what is the current health status. That's number one. Whether you are doing well or not doing well, that's number one. Number two, typically, you should be able to get some solution for the problem that you may have lately. But just the patient don't know, or maybe do not have an opportunity to talk about their problem, right? So this is number two. Number three, medical record or medical checkup details is actually what we call, it is a guideline for you to monitor your health. So this year you come, you do health screening, the doctor update what is the health status. So next year you come, then they do the health screening, they update the health status. So every year when you come and do, you have a better understanding whether you are improving your health or you're not improving your health. So that is what you can actually attain from the consultation given to you by the medical officer or the general practitioner. Recommended, the best to do blood test is when your age turn to another age. Means that when you're age of 30, what is your medical report? When you're age of 31, what is your medical report? So you need to do once a year, because every year when you age, your body change, biologically everything change. It's due to many reasons. Our lifestyle, eating habit, stress, right? As your body bombarded with a lot of stress, so you need to pay more attention to understand what is actually happening to your body. So it goes by that way. There are people who do the medical screening once in 5 years. Their reasons always, they say that I have my way of taking care of my health. I eat good food, I know how to take care of my trash. I'm not a person who actually working in a very stressful environment. So, and some of them, they have their own so-called home kit, right? BP machine, sugar, what I call glucometers, they can do it at home. So they always say, why I need to go to hospital and do it every year? So I can go like once in 5 years. So it's all different interpretation. But medically, we recommend when you hit the age of 40, it's best for you to come once a year. Yeah, but that's where you develop most of the health issues, especially heart. When you are age of 40, you're prone to have a lot of issues with heart. You're prone to have a lot of issues with heart-related diseases. Yeah, so that's why we recommend when you're 40, you have to go for once a year medical checkup.